My name is Kelly Matamo, and I'm making this video for Nursing Management and Leadership. The quality improvement initiative that I chose to focus on was improving vaccination rates by using clinical decision support system in the electronic health record. This initiative is currently being addressed at Andrews County Health Department in Andrews, Texas. I completed a SWOT analysis and interviewed their administrator, Dr. Deborah McCullough. She's the QI representative, and it became clear that this initiative had transitioned from just using the clinical decision support system to improve vaccination rates to also attempting to improve patient or parent engagement in order to improve the vaccination rates. The SWOT analysis showed that the internal strengths of the health department included the engagement level of the staff, their current electronic health record and its flexibility, and the support of the electronic health record vendor, as well as the capabilities of the people that use the health record. The staff also played a role in the weaknesses on the SWOT analysis, mainly in the amount of training that it takes and that is needed to be completed for them to be proficient in using the clinical decision sets and the order sets and the EHR, and as well as the technological skills for some of the staff. Opportunities for improvement were identified as expanding the training on the EHR, using order sets and the clinical decision support modules, and then a new version of their electronic health record will be complete in August, the end of August of 2018. Threats identified in the SWOT analysis included mostly funding. They are a grant-run health department. They do get some money from the county, but most of their programs are grant-funded or funded through different businesses in the area. So if the economy is good, then they have more money to help the community. Evidence used to determine that an improvement was needed were basically the vaccination rates. They were consistently below 80% in children 19 to 35 months for their first set of diphtheria, tetanus, and pertussis, polio, measles, varicella, rubella, H. influenza type B, and the pneumococcal conjugate. They wanted children to at least have completed the recommended series by their second birthday. The national standard being met by achieving this goal is the electronic clinical quality improvement standard for child vaccinations, and also the national standard set forth by the Advisory Committee on Immunization Practices. The quality indicators used to measure the improvements are established by the Agency for Healthcare Research and Quality and are based on the recommendations from the Advisory Committee on Immunization Practices. HEDIS, or Healthcare Effectiveness Data and Information Set, measures and assesses children 2 years of age who have had the 4313314 series by their second birthday. The data that's collected is collected from several sources. The Texas Department of State Health Services randomly selects 50 charts and calculates the data and enters it into the comprehensive clinic assessment application, and then those rates are calculated and reported to the Texas Department of State and Health Services. Because Andrews County Health Department is a nurse-run clinic, nursing is involved in the entire process. Nurses initiate the policies, they follow the policies, they evaluate how well they're working. The only other departments that are involved in this initiative would be their consulting IT company that helps keep them up and running. They are a rural area, so keeping everything connected. Also, currently they are working with the consultant from eClinicalWorks in order to use their electronic health record to try to increase the patient engagement scores. The biggest challenges that the health department faces right now in meeting this goal is the number of parents that are opting out of vaccinating their children. That number is continuing to rise, and there's also legislature currently proposed that would make it easier for parents to obtain exemption forms and opt out of vaccinating school-age children. The other challenges are mainly related to the staff. the learning curve for new staff members and the staff not continuously following processes that are implemented. Educating parents on the importance of vaccines and providing them with evidence-based recommendations and helping stop any of the misinformation that they're getting can help increase these numbers. Restructuring the new staff orientation process is also going to help with meeting this goal. In order to make these changes, the administration at Andrews County Health Department as well as the nurses would need to be involved. The representative with eClinicalWorks can also help provide recommendations. With this current initiative, increasing patient engagement is the goal. Because this age group is too young to take advantage of the back-to-school fairs and things that they do, where you can target that population and get them vaccinated and reach out to parents, these kids aren't going to those things unless they have older brothers and sisters. So the idea is to use a smartphone app to try to get parents plugged into the health department, to make it easier for them to schedule appointments, make follow-up appointments, as well as let them have electronic access to their child's vaccination record. This is all done with the hope that more parents will elect to vaccinate their children. This project is currently budgeted for $3,000 and is scheduled to be a 3-month-long project working directly with the consultant for eClinicalWorks, but the data will continue to be monitored for another 2 years after this. As of June 2018, immunization rates in Andrews County were at 93.4%. So the new goal that they have somewhat transitioned to try to utilize eClinicalWorks and the money that they've already spent is to try to increase the number of parents or patients that sign up for the patient portal by at least 50% in the next month. I think what I got most from this assignment and from interviewing Dr. McCullough was the need to reevaluate and possibly change your targeted outcome. You know, they met their goal fairly easily for increasing the vaccination rates, but they did that by increasing patient engagement. So by taking on the new goal to increase patient engagement, it will help the vaccination rates, but also could potentially help kind of throughout the county as far as getting people in and being able to have them to educate and do more preventative care and screening. Thank you.